Awesome. Okay, welcome back to the Blackhawk County Public Health Newcomers Forum. We have Dr. Nafissa Egbounye joining us today to discuss the Medicaid Unwind process and Molina healthcare. So at this time, I'm going to turn it over to Dr. Egbounye and we'll get started.
Thank you, Tracy, and it's good to see you. Then thank you for the opportunity to speak on Molina healthcare and the Medicaid Unwind process. We have been very, very busy, but I think this is a good opportunity for everybody to understand what's going on in the Medicaid world. Molina Healthcare is the new MCO in town. We are the new managed care organization that will be launching on July 1st. We're a plan that is committed to improving the health and well-being of all Iowans. Molina is looking forward to serving the people of Iowa and has been serving the most vulnerable communities across the country since 1980. And it's a plan that started like a neighborhood clinic and is now a Medicaid provider in 19 states, and we're serving approximately 5.2 million people in the United States. So very excited to be part of Molina. Our leadership team are fellow Iowans committed to serving all Iowans. And our plant president, who's Jennifer Vermeer, previously worked for the University of Iowa Healthcare and the University of Iowa Health Alliance. She also has a long history of as a Medicaid director, and so is very, very knowledgeable about Medicaid here in Iowa. And our chief medical director is Dr. Tim Gutschall, who has practiced the medicine for more than 2 decades and served as vice chair of the 3 clinics of Iowa. And I am Nafissa Egbounye. I'm the Associate Vice President of Growth and Community Engagement, previously the Public Health Director for Blackhawk County. But most importantly, our leadership team is very intentional about ensuring that we communicate effectively to our Medicaid populations so that they understand what is going on in Iowa. So Molina Healthcare of Iowa is built for Iowa by Iowans. We have a comprehensive and holistic approach when it comes to the well-being of our members. We also have a large provider network that will enable members to access the care they need wherever they are and whichever doctor they want. We're being very intentional about continuing to build our provider network. We also have expertise in long-term services and supports for older adults and people with disabilities, coordinating services for complete care. And we have a plethora of wellness and preventative services. Now, these value-added benefits such as Weight Watchers and doula assistants, smoking cessation products, and over-the-counter medications. We have a ton of things for our member. And Molina not only helps members get the medical care they need, but we also offer support services to help members get healthy and stay healthy. So how does Molina look to serve Iowans? We care deeply about the communities we serve and partners with local organizations such as local public health to support not only our members, but others in need. This is very intentional for us. We're health equity focused, and our community health workers are going to assist members with finding housing, food, clothing, transportation, scheduling appointments, and we also match members' need with the strengths of our community partners. This is very intentional because we want to reduce health disparities. And so we're intentional about ensuring that the members, are matched with the appropriate community partners, but also we collaborate with community-based organizations to address the unmet health needs, improve access to care, and promote health equity. You will also find Molina frequently at local events, distributing like our materials, like necessities like clothing and food with other community-based organizations, and ensuring that all of our members receive important information regarding Medicaid and community resources. We have been recently active in certain events. I have to say, this month is Black History Month. Molina was at All Make Me a World Festival event, sponsoring. We are the sponsoring gold sponsorship, and it was just great to be there among communities. Molina will be at the Rocky and Shaviva show this Friday, and so being very intentional about being part of our community. We are more than just a health plan, but we are part of the fabric of the community. And so I just want to make sure that I'm not just speaking and just not pausing, but if there's any questions, please feel free to ask me. This is, I can say this, Tracy, right? This is an open forum conversation. But in addition to just the things that I expressed to you all, we offer quite a huge amount of additional benefits for members. And so pregnancy programs for healthy moms and babies. So we have gift cards of $100, doula assistance, car, booster seats, all those goodies. Also, over $200 in gift card rewards for completing preventative services. This is important for us because we know that our members have needs, and so we believe that these incentives will also motivate people to be able to get these preventative screenings. So make sure that you let people know that we have over $200 in gift card rewards for completing preventative services. So Molina also offers like free rides to food banks, WIC, transportation to job interviews and trainings. We're also offering youth club memberships. We know that it's very important for our youth to get physical activity. And being here in Iowa, we just yesterday had a really crazy snow day, but it is really important for our youth to be able to get out and do some physical activity. And so we offer youth membership, but also for our our caregivers with the long-term support services population. We offer caregiver transportation to visit a member residing at a long-term care facility and more. And so that's important. We want to make sure that people, there's no barriers in terms of visiting a loved one or a friend at a facility. And the healthy food program. So taking care of your health is very important, your physical health, but we also want to make sure that people are receiving nutritionally adequate meals. And so we do have a healthy foods program as well. So that is Molina Healthcare. I will share the link to our website. It's welcome to Molina.com/Iowa. And really, we're very excited to be in Iowa. And Molina is what we do is Medicaid, right? So what we do is Medicaid, and that is similar to all the states in which we serve. Medicaid is our primary role, and so very excited about that. Please feel free to also follow our Facebook. It's Molina Healthcare of Iowa Facebook, and so we will share information in our Facebook. And future members also have the ability to manage their healthcare online at Molina.com or download the app, My Molina app. And so it was important for me today to be among you all because, you know, as I stated earlier, things are happening, moving pretty fast and with Medicaid here. And I want to ensure that people know that there is a new MCO, and we are the new MCO. We are here to serve our members. And come July 1, we will go live here in Iowa. Another thing that's so important for people to understand is that the Medicaid Unwind, right? So starting April, most Medicaid members will go through a redetermination process during the 12-month unwind period to determine if they are still eligible for any Medicaid program. It is important for people to pay close attention to their mailbox. The state will be providing communication in regards to you know, ensuring that people's addresses and telephones are up to date, so that you know, people are receiving the communication the state is sending, and this is to ensure that any documentation that one needs to go through the redetermination process, that people are aware, and so we want to make sure that people pay close attention to their mailbox. But in addition to that, also for people to pay close attention to Iowa Medicaid's Facebook page, Molina Healthcare's Facebook page, and I would say also our Iowa Total Care Merit Group. There will be communication that will be sent out to ensure that people are getting the information that they need and go through the redetermination process. So it is really critical that Iowa Medicaid members have up-to-date contact information and mailing addresses. And members should expect from Iowa Health and Human Services and respond to any request for information in a timely manner. And we don't want anybody to lose their Medicaid, so it's really important for people to be proactive and go through that redetermination process. So this is something critical and so important. So the most important thing when it comes to the Medicaid Unwind, please watch out for mail from Iowa Medicaid. You know, that is the one that is very important. The second thing is, once you get communicated, respond to requests for information, right? It's so important, again, to be as proactive in responding to that. And if you need help, if one needs help when it comes to this stuff, we are here to support you all. And so, you know, please contact the member services for Medicaid or Hawkeye New Rule. And that number is 1-800-338-8366. You know, agents can help individuals walk through the renewal and direct you to the correct resources, depending on when your renewal is. Molina will also communicate to inform members of the importance of updating their addresses with Iowa Medicaid. And please, again, follow our social media page and visit also our website. And we will also conduct outreach calls like 60 days before the members' renewal date. If members approve for text messaging, they will also receive communication via text. You know, if there's anything in regards to the Medicaid Unwind, it's very important that members ensure that their addresses and phone numbers is correct. And so I would say, Tracy, if, you know, especially our immigrant and refugee communities, you know, where I'm speaking in English right now, I could easily switch to French, but I won't do that on this platform. But I think one of the things that's very important for the immigrant and refugee communities is to try and get word out in the multiple languages, just so that they are aware of what redetermination means. And you know, feel free to reach out to Molina and see how we can do that as well. So thank you.
Wonderful. Thank you. I think we will stop recording at this point.